So the
Hope it
disease
answers your
modifying.
question.
Yeah, that's fine. I think Dr. Gibson had a question.
Professor Nikit, thank you very much for a very nice presentation. I'm a cardiologist, and my concern is that in patients with rheumatoid arthritis, you have a lot of complications as far as valvular heart disease is concerned. You can get pericardial effusion, cardiomyopathies in these patients. Is there some kind of a caution in these patients to use rituximab, like for example arrhythmias which can occur as a result of this?
Okay, the question is, does rituximab have any side effects like arrhythmias in patients with pre-existing heart conditions?
As far as anti-TNFs are concerned, there are warnings for the use in congestive heart failure. Usually rheumatoid arthritis does affect the myocardium, but it is very rare to have like a cardiomyopathy due to rheumatoid arthritis. So it hasn't, in our patients, we didn't notice any cardiac rhythm abnormalities. And in the literature also, although with any TNF or with any agent, cardiac abnormalities are mentioned, but they are not like contraindications if the patients are not in class 3 or class 4 heart failure. That's for anti-TNFs. G, anti-TNFs also, more so in anti-TNFs,
The
but
box
with
warning is more for
rituximab,
anti-TNF.
for anti-TNFs, but for rituximab, not really.
Rituximab is not an anti-TNF, it's an anti-B. There is a, sorry, I think Dr. Gibson had a question as well.
Nico, thank you very much. All the questions seem to be directed at you, but I was curious to see that 95% of your patients were seropositive, and you didn't emphasize the value of knowing whether a patient is seropositive or not, because we know that the responsiveness to rituximab is dependent upon the presence of rheumatoid factor.
Ideally, we wanted to do anti-CCP antibody on all of our patients, but it was costly, so we could not do it in all the patients. So, as far as rheumatoid factor is concerned, rituximab patients with RA or seropositive have definitely a better response to rituximab, and all our patients except one was seropositive. And in the seronegative also, when we had exhausted all options of treatment, we did give that patient rituximab. So 20 patients were, we had one patient who was RA factor negative, but rest all of them were rheumatoid factor positive.
Thank you so much. I'm sorry.
Just
the last question, Dr. Nikhar.
Let it be the last one. Thanks so much for those lovely lectures and nice research work. I just want to comment on, it's really nice to know that you, since I've been a teacher, that we have been teaching these criteria for diagnosing rheumatoid arthritis, those criteria, and then we choose 4 out of this. Now, as things are changing, I'm so happy that you have changed also the criteria, but I hope it starts coming in the books also, because looking at the 6 weeks criteria of having body pain, of pains in the muscles or joints, and then coming to a diagnosis, I think it's already too late. 6 weeks, you are losing 6 weeks already, and then you make a diagnosis.